Hello, my name is Dr. Jason Cuellar. I'm a board-certified, fellowship-trained orthopedic spine surgeon, and I'm here today in Key West, Florida, an amazing little island outside of Miami. One of my best patients, Brandon.
Hello.
All right, well, Brandon, was it a hard decision to make, after I made that recommendation of the 3-level disc replacement, which is a pretty big surgery, and it's very scary for a lot of people?
It all depends on your mindset and where you're at with being fed up with the amount of debilitation that you're experiencing in your life. And for me personally, it was getting debilitating. I would try to teach my class here, and I would be able to do some of the techniques, but I was kind of shortchanging the students because I would have to do certain things and not do certain things. And in my personal life, picking up my kids, as you said and alluded to earlier, I'm a pretty strong guy, and I've set state records in powerlifting, and ultimately for me to think about being less than or weak was terrifying. And ironically, what's happened as a result of this surgery is I've gotten my ability to do all of the things that I love back, and I'm getting stronger every day. But yeah, it was terrifying, and it is a big procedure, and it's not a decision that I think anyone should take lightly. I can only speak for myself and the results that I've gotten, and it was well worth it for me.
That's great to hear. And it's always hard to choose a surgeon. I mean, what made you decide to have the surgery with me?
To be quite honest, my wife. All right, I had looked into a couple other surgeons, and I actually met with them. One of whom did Jiujitsu, and we had that common bond, but I still didn't see myself entrusting my care to him simply because the term bedside manner gets thrown around a lot, but ultimately, I don't know, it's a combination of factors that are responsible for how you feel you're going to be able to relate to somebody who you are entrusting your entire well-being to. And we just weren't 100% compatible in that regard. So, my wife had pointed out that you do these and you were now in the area and that you had this surgery yourself. And I thought that was interesting. So I started to read a lot of your reviews and information about the procedures that you've done in the past. And once I had our initial conversation, the decision was pretty easy. I just felt like you and I really clicked, and you had my best interest at heart. And you were going to listen to me and what I needed to get out of this surgery. And I guess ultimately I'm a pretty smart guy, because that's exactly what happened.
So as you may know, I myself had lumbar disc replacement done by my mentor and former partner in Beverly Hills, Dr. Todd Landman, about 5 years ago. Now, when making your decision to have the surgery or with whom to have the surgery, did that have any impact on that?
It did. Ultimately, I wanted to go to someone who could relate on as many facets and levels, pun intended, as I could, right? And you having had the surgery was huge, but also, as I previously said, the track record with the surgeries that you've done and the fact that you were still, pardon the pun, so high on your own was really a motivating factor for me to make the leap of faith that I did. But ultimately, like I said, I'm a real people person, and at the risk of sounding corny, I'm a Pisces. So when I read someone, it's usually pretty accurate. And I kind of felt like if anyone's going to do this, the time is right, the technology's right. I believed in the product that you were using, and I really wanted to maintain my ability to keep the ranges of motion that I've worked so hard to obtain my whole life. And that was something that weighed in, but ultimately I was going to go with you regardless, just off your track record here and the people that you've seen and the good things that I've heard in meeting you.
You had the lumbar disc replacement surgery. Tell me about that whole experience, just from the preoperative to the surgery, post-operative recovery.
It was wild. That's not a word I throw around. I've been through a lot in my life, and I've had some fantastic experiences on both the good and bad end of the spectrums. this was something that you can't really prepare yourself for mentally, but the actual procedure itself was pretty straightforward and easy. And you know, I have you guys and an excellent staff at the hospital to thank for that. The preoperative care was wonderful. People checking in from your office and making sure I had everything, help with the ensuing paperwork, all of that went flawlessly. But the biggest thing to me was, again, once I decided to do something, I'm just the type of person that just goes into it, was the utter amazement. You know, I've had other surgeries on my shoulders and on my knee that, you know, you were literally replacing 3 levels out of the 5 in my lower lumbar region. And I went under, came out, walked out of there, and went to breakfast and dinner with my wife the following evening and morning. And I haven't looked back. So I would tell anyone that's even considering this to, yeah, of course, do all of your research. Make sure that you've reached a point with your own personal pain levels and you know, let the doctors look at your imaging and tell you where you stand. But once you decide to do it, I feel like you're probably one of the best people in the world that does this, in my view. And I feel like once you've gotten to the point where you're decided you're gonna have this, you can't go wrong going with you and your colleagues. And I say that as somebody who has his life back. Like, I'm pain-free.
Well, I appreciate that. I'm so happy that you got an awesome result.
All of it was pretty easy. I just am the type of person that really pushes himself. And I think when you do too much too soon, it feels like you are instantly aware of that. But I never felt like I was in jeopardy of the surgery failing or anything like that. It really felt more like I just was trying to push the curve too quickly. But I want to stress that I was literally pain-free walking 2 weeks after this surgery. I mean, I was doing, we have a 7-mile bridge here in the Keys. My wife and I walk it all the time, and I was literally going back and forth over that thing as part of my rehab at 2 weeks, 3-4 times a week. So I would tell anyone that, you know, is considering it, especially if you're active, hang in there, right? Like, yeah, you're gonna be pain-free, but you're still gonna have some stiffness and you're gonna have some obstacles to overcome, like any other physical therapy for anything else that you do and anything related to coming back from an injury. But if you do those things diligently and you listen to the surgeon and you listen to your body, you could wind up in a chair doing a really cool interview from a jiu-jitsu mat.
Well, I saw you today. I mean, you were teaching these students, you were rolling with some high-level jiu-jitsu students, and it was really awesome to see, you know, you back on the mat. And I know you sent me pictures of you kayaking and doing everything else. So is there anything now you feel like you're still being held back from, or you feel like you're able to do everything you want to do?
I feel like I can absolutely do everything I want to do. Now it's just, you know, and it's funny, I'll use a jiu-jitsu analogy. I tell my students the difference between executing a technique expertly and like a white belt is in the details, right? It's just like anything else in life. And this is no different. I just have to listen to my body. I still feel like I'm healing, and you've told me as much, that's fine. But I do feel like there's been an incredible increase in strength and mobility. So now I'm not holding myself back from doing anything. I'm just sort of tempering it with a little bit of new respect for being able to do these things that I had previously not been able to do due to this back pain. So no, I think it's great.
Awesome. So at the end of the day, are you happy you had the disc replacement surgery?
Extremely. And I think anyone that sees this interview is going to be able to get that pretty quickly. But again, I want to stress this because it's hugely important to me and anyone else that's considering going through it, which I'm always happy to talk to anybody that has questions about this procedure. I send a couple other people your way that will probably be calling you. I really think that it's a personal decision to partake something that seems this extreme. You know, it's a hard concept for people to wrap their heads around. But with the results that I've experienced and the way I continue to feel stronger and better every week, I really don't think in good conscience, I could tell anyone that was deemed appropriate to receive the surgery not to do it, because I think that would be a real disservice. And I think if they are financially and medically able, that this is a real alternative to going through a life that is less than.
All right, well, Brandon, you've been an awesome patient to take care of, and obviously you're my patient for life now that I've done surgery on you. It's been really great to see your improvement, your fast improvement. I mean, your mental strength and physical strength has certainly, helped you get over this, quickly.
I think what I would like to say to that is, first off, thank you. I mean, that means a lot to me, but I would rather be, at this point, your friend instead of your patient. Of course, I will always be both, but ultimately, I feel like this went well enough that I don't really feel like this is going to be an issue for me in the long term. Maybe we'll exchange X-rays instead of Christmas cards here and there, but ultimately, I think if anyone is considering having this done, you're a great person to have do it. And my results have been so good that it's one of those things where you have a lot of trepidation at first, and this doesn't happen often in life, at least it hasn't in mine, but you have a lot of trepidation at first, then you actually go through with the event after a lot of soul searching, and one of two outcomes happens, right? Like you either are like, okay, I did it, it didn't go as expected, but I want to see what I can take from it as a learning experience, and we'll move on. Or conversely, like in this scenario, it goes exceedingly well, and you're faced with new possibilities, and things that you felt like you couldn't do for a long time are now doable again. And for that, I owe you a huge debt of gratitude.
Well, thank you. It's been such a pleasure.
You're very welcome. Thank you.